It is hard to see where the world will be 6 months or a year from now. One question that is being debated is whether we have to get used to the idea that the coronavirus is here to stay. In January, the journal Nature asked more than 100 immunologists, infectious disease researchers, and virologists whether they think the virus can be eradicated. 89% said no. They think it's very likely or likely to become an endemic virus, meaning it will continue to circulate in pockets of the global population for years to come. It is a big topic, of course, and Dr. Sumon Chakrabarti is an infectious diseases physician at Mississauga Hospital. He's here to help walk us through this. Doctor, one epidemiologist in this survey said eradicating this virus from the world is a lot like trying to plan the construction of a stepping stone pathway to the moon. It's unrealistic. What is your view?
I agree with that. You know, a respiratory virus job is to basically go from person to person. It can happen when you have very little symptoms. It's very, very contagious in that sense. So it's not something that you can completely eliminate. But that said, it's going to change the way it actually is over the next several months and become something that's more like a circulating virus. Like we see with influenza, it tends to cause problems in the wintertime, but it's something that's not going to be the same type of bad pandemic spread that we're seeing right now.
Well, is that what it means when a disease is endemic as opposed to a pandemic? And how does that actually affect the population?
Yeah, when you have an endemic disease, it's something that's there at kind of a low level of transmission. And you might have some times where there's spikes in transmission, but it's not the same as it is right now where we have these massive spikes that can overwhelm hospital systems. It's more something that happens, seasonally. And we deal with this every year when we deal with influenza. So it's something that we live with. You can do it for years, and you have a vaccine that can keep things even better under control. And I think that's what we expect to see in the next several years.
Yeah, well, I want to ask you about what role vaccines will play. They'll reduce the risk of infection, of course, but will they be game changers that will really allow economies to open up?
Absolutely. Obviously, it's part of the entire picture that we're having with our fight against the virus, but vaccines are a huge part of that. It takes severe disease and turns it into something that's mild or non-existent. And with that, you can have a lot of pressure taken off the hospitals. You're saving lives, you're saving morbidity, and all these types of things are our ticket out of the pandemic. I do expect that we might need boosters in the future, but to have another pandemic with this same virus is very unlikely. So things will largely get back to normal as 2021 rolls on.
So if the virus does become endemic and is going to be with us, what do we do? What do our lives look like from day to day?
Well, our lives would look, to be honest, the same. It's just that in the hospitals around the wintertime, December, January, this will be part of our respiratory virus panel that we'll look for when people come in with respiratory symptoms. We'll have to brace for it because there are times where there are a lot of patients with respiratory illness that require ventilation or hospital support. So we will look for that in the healthcare system. In the community, we don't have to really do all that much, just like you don't do right now. But again, the general things, washing your hands and that type of thing, it will still be very important.
You know, Australia and New Zealand are attempting to have zero COVID, and they lock down right now when even one case emerges. Is it possible that that could become the norm, that some countries will effectively eradicate it and only people who can prove they aren't infectious will be allowed to go there?
You know, I think that's possible, but unlikely, because at some point they have to open their borders. They have a very significant advantage to us being geographically isolated, and that's one of the reasons they were able to do this in terms of the COVID zero. But that said, that at some point in the future, they're going to be having COVID, but it's not going to be at a very high level. They can deal with it with vaccination, and any cases that come in the hospitals will be able to deal with it overall. So it'll be back largely to the same style of life that was pre-pandemic.
Well, that's a positive message. Dr. Sumon Chakrabarti, thank you so much for your expertise.
Thanks so much for having me. Take care.